Family planning allows people to attain their desired number of children, if any, and to determine the spacing of their pregnancies. It's achieved through the use of contraceptive methods and the treatment of infertility. Contraception is a way to prevent pregnancy, and there are many different types of contraception. Some are more effective than others. Although different contraception methods work in different ways, contraception generally prevents sperm and egg from meeting, which is how a pregnancy starts. The prevention of unintended pregnancies helps to lower maternal ill health and the number of pregnancy-related deaths. Today on your favorite health TV talk show, The Physicians, will be discussing female contraceptives, available options, and consequences of long-term use. It's another day on your favorite health TV talk show, The Physicians, where your health is our business. My name is Dr. Memuna Yusuf Kadri, the anchor of this program, of course, with my regular, beautiful, and amiable co-host.
I'm blushing. My name is Dr. Martina Agbere. Welcome to your regular health TV talk show, The Physicians, where your health is our business.
Of course, as usual.
Always our business.
So we are talking about female contraceptives today. Generally, what are these available options and what are the consequences of long-term use? One question I want to ask you before we dive into it. Have we gotten to that place right now with all the diversity, equity, inclusion, feminism movement that you believe? Why are you laughing? Let me land. Okay? That you think women still have gotten to that state where they can boldly own it, that this is my option, this is what I want to do, without interference from cultural, religious, patriarchal factors.
Okay, so if you want me to grade this on 1 to 10,
yeah,
I would say we are still like 3.
We have not reached half. So.
We've not even reached half. No, we've not reached half. Because it's
what are your reasons for that?
Culture, religion, and the male factor. Now the women are still the ones that still want to seek that the use of the contraceptives. The male don't even consider it. They don't. It is not about the. It's not about using the medication. When you talk about contraceptive, it's the barrier method.
Exactly.
Okay, so that you do not get pregnant. Okay, but for the men, women will use different things. Okay,
yeah.
Men, the one that is even they don't even want to hear about is the vasectomy. It's also a form of contraception.
Yes, but they are not looking into.
They're not looking into that. But you know, if in real sense, the woman, okay, goes and does all those other ones, the pills and all those ones, then only one thing that the man would do
is refusing to
do. Save the woman the whole stress.
You're right, because if he does vasectomy at their marriage,
the woman doesn't need to use any pill.
And what if anything happens? Maybe the vasectomy, there's something that happens. Miracle.
Baby?
She still now gets pregnant.
There'll be a problem. If they, no, or if it's really confirmed vasectomy and she gets pregnant, then they have to go to court. Yes. If you do real vasectomy,
that you know that there's nothing is there.
Yes.
So they can't be mistaken in vasectomy or something.
Not when professionals handle it. You know how vasectomy is.
Yeah. We'll be right back after this time out. Do stay tuned. Welcome back. If you're just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. Today, we are going to deep dive into the topic we have for the day, which is female contraceptives, available options, and consequences of long-time use. With us in the studio today is when we talk about a moving encyclopedia, no other person than Professor AKINLOYE BAMIGBOYE, the MD CEO of LOUISMED Hospital, here in Lagos, Nigeria. Prof, you're welcome.
Thank you very much.
As usual.
Nice having you back.
Nice having you as well.
Prof, you know, behind the scene, before we came on set, you talked about the fact that this topic, female contraceptives, right, in med school in the 80s and 90s was something that was a bit of, it came with a bit of controversy. And it's good for us, for viewers also to know, okay, what is it about this female contraceptive? What was the controversy then, and why is there no controversy now? But generally before, you know, why setting the pace for this discussion on female contraceptives?
What is contraception?
Yeah.
Contraception is the ability, ladies and gentlemen at home, my viewers, ability to prevent pregnancy when you want it, how you want it done, and that is it. You just have to find a way out.
Simple and short.
Easy.
When and how you want it.
When and how you want it. So that's contraception. And the controversies around it then and now has always been the side effect. What options do I have? What are the side effects? Is it a short-term side effect? Is it a long-term side effect? We take all those into consideration before you choose a contraception. And that's what we are going to be discussing today.
Okay. So what are the available options?
If you talk of female contraception,
Yes.
the first option is abstinence. Do not go there.
Okay.
That's a
Rule of thumb.
It's a good one.
Yeah.
If you don't go there, you won't fall pregnant. But is it possible? I bet you not a lot. Very
Except
few
those for spiritual reasons.
for spiritual reasons, like
Nuns.
like the nuns. Yes, they are like the nuns. They can escape it, you know, but it's their own wish. But
So there are some that are not even known that just decide that this is what they want to do. They don't want.
yeah, they will not.
Yeah.
So, but those who are exposed to sexual intercourse and they want to have contraception, then they have the choices, of which I will list out now.
Okay.
There are women who would say, okay, I want to use the natural method of prevention, which is called the Billings method of ovulation, to prevent contraception, to prevent pregnancy. So those ones are saying, okay, when the risk of pregnancy is highest, I'm not going to have intercourse. So there are ways of explaining that to them. There are ways of which they will accept it. That's one. Then there are the unnatural method. The unnatural ones are what we are going to be talking about. Those on the tablets, combined oral contraceptive.
Okay, sorry, before you go to the unnatural, you already talked about the Billings method.
Yes.
Being natural.
Yeah.
Okay. How about the breastfeeding? That is also natural?
Okay. Can you see, that is one of the controversies that we're talking about. Breastfeeding.
Okay.
Because you can be pregnant when you breastfeed. That is a fact.
But the WHO says exclusive breastfeeding.
Even if you do exclusive breastfeeding,
is it possible?
you know, which is for like
6 months.
6 months.
Okay.
Yes. Breastfeeding on demand.
Intercourse,
Yeah.
and you are not even menstruating.
You can still fall pregnant. Proper said it. You can still fall pregnant.
You can still
So
fall
now,
pregnant.
so you can't be telling people that. No need to tell them that breastfeeding is also.
It will decrease your risk of falling pregnant, but it will not take the risk away. Because you are seeing a man and the sperm is being injected, that will swim along the pathway, fertilize the eggs, form an embryo, comes back and implants into the uterus. That is
So these are what you are saying is a recent survey that is confirming it from what WHO has said.
You see, WHO has just said the risk is going to be
Lower.
decreased.
Not that it's absent.
No. If they say that, it is wrong. And I know WHO cannot be wrong.
So before you go to the unnatural, right? Let's just end with natural. How about the withdrawal method? Is that, will you classify that
that
as
is also
natural?
natural. The withdrawal method. The one that you're talking about, the breastfeeding, is also natural. But those are just lower risk.
Lower risk.
Even if you withdraw, it's still a problem because you still run a much higher risk than using a contraceptive proper.
How about let's go to the unnatural.
The unnatural method, okay? That is where the issues are really. Because the unnatural methods are things like combined oral contraceptive, the barrier method of prevention, which is condoms and the intrauterine devices. How you see this? which other one? Condom I've said. Then
The
operation, sterilization
Sterilization.
is also there.
You're talking about the barrier method. Maybe it will be much easier if we can break it down, talking about the barrier method, the hormonal methods, and the sterilization. Also. So it will be easier to be able to list the proper
so as I said, barrier method of prevention.
Okay.
With mention of condom, mention of IUCD.
The female condom inclusive?
Female IUCDs. Even IUCD can also be hormonal method, because the IUCD these days, there are some of them that come impregnated with progesterone, which is a hormone that prevents pregnancy. Okay, those are the barrier ones.
The spermicide is also a barrier one?
Spermicide, both barrier and hormonal. Okay. And also even chemical. Okay. Because spermicide is not as effective as the other things that we know. Because it was popular in the 1980s, I'm sure, 70s, whereby women like to use spermicides after intercourse or before intercourse. Okay, so but it really does not confer adequate contraception.
So for the men, they have the condom, and you also have the female, the diaphragm, and the cervical.
Yes, we have that. We are very correct. Okay. We have the diaphragm. The diaphragm is not popular around here. The female condoms is not popular. But
you hardly see female go to say, I want to buy the female condom.
But I have in my office, I can give you, well, I don't know, if you are too old now. I'm not serious. Otherwise, I can have female
those that require is
those that want it.
There is female condom. For what Prof is just generally saying and talking to all of us and to our amazing viewers, when we talk about the barrier method, we have the male condom and also the female condom. So if you are focusing on female contraceptive, it just generally means that you don't completely have to rely on your male partner to use the condom. You can also use as a female. So I think that kind of explains it. Yes.
That's it.
So hormonal, you talk about barrier, the hormonal one.
Hormonal,
the pills.
Hormonals, they are the pills.
Okay.
Okay. They are these progesterone impregnated devices, which has got advantages over the pills. I know.
The injectables.
The injectables, the one you take every 2 months and every 3 months. They are there.
How about the contrast? The patch.
The patches are also there. There are quite a lot of it. The hormones are meant to manipulate the mechanism of pregnancy and prevent it.
Okay.
The way the hormones work generally is number one. It works on the cervical mucus. It makes it to be viscid. To preventing the sperm
from
yes, that's number one.
Okay.
Number two is some of them make the endometrium, the lining of the inside of the womb, to be atrophied, to be dry. So that
become so
tight. The movement of sperm across into the tube
is also reduced.
Possible, yes. So those are the things. Then there are things. They are almost that will prevent ovulation. So these things can also prevent ovulation. That way, it happens. Many other things.
Okay. The other method, sterilization.
Sterilization in Nigeria is not still acceptable to women, honestly, because I've seen a lot of women comparing Nigeria versus outside the world. I know how many cases I do in a week when I'm outside. In Nigeria for almost 4 years, I may not do one. In fact, for more than 8 years now, I think I've done only 2 in Nigeria. Whereas in South Africa, I do sterilization every week, like 2, 3, 4 every week. Okay. Here, I've not done probably one.
Is it our culture or religion?
What you said earlier on, the issue of culture comes in. You know, people we don't want to go and subject themselves into it, or somebody tells you in the church that don't do it, or most I don't know.
In your next life, we should do it.
Your mother-in-law will tell you, what are you doing? No, I'm not interested in that.
When you mean sterilization in women, what does that really mean?
Sterilization in women is getting the fallopian tubes, both left and right, taking it out and removing or tying the tube, so that there is a mechanical absorption of sperm
and is it reversible?
Meeting, Okay, that's a very controversial one. It's supposed to be irreversible. When we cancel, it is irreversible. But some women are quite wise. They will tell you, "But how can it? Is it not you that did it? If I want to have a baby, for
Because this topic is becoming very controversial. Yes, because you are telling the woman it's irreversible. 5 years time, she's coming to tell you, I want a baby, and you did that surgery, reverse it, and I don't want to hear anything.
Just a tie that you did.
Exactly.
So
you can untie it. Let's keeping up with the physicians, and let's talk about female contraceptives. Have you used it before? Do you know anyone that has used it? What are the options that you know about? And if you've known anybody that has used it, what are the consequences of long time use? Share with us. We'll be right back after this time out.
I think it's a way of preventing unwanted pregnancy. Yeah.
To prevent some certain unwanted pregnancy, you make use of those tablets or some injection. It interrupts the monthly flows, and of course, I wouldn't know if it later affects the womb in having any baby in the future.
I don't really know much about it, but it's not advice, because it do cause some harm, something like that.
Welcome back. If you're just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. With us in the studio today is Professor AKINLOYE BAMIGBOYE, the MD CEO, LOUISMED Hospital here in Lagos, Nigeria. And he has been schooling us on female contraceptives, the various options that are available and consequences for long time use. Before we went on break, we went into something a bit controversial, which is women in Nigeria versus women in South Africa, because it's a prof that has been in both places, worked and lived in both places. While in South Africa, at least once a week, you get a woman coming in for sterilization, meaning tie my wombs and I don't want to have babies. But here in Nigeria, past 4-8 years, sometimes doesn't even get any patient to see to even do that. And we said, now, Prof, if a woman comes, you've tied the tubes, and 5 years later, something happens, or she just wakes up and realizes, I need a baby, a retirement benefit in the house, somebody that will just be making noise. You tied my wombs, you just tied it. To her, you just tied it. So now untie it because I want to have baby. How does that work?
All right, I think it's more of counseling here, work that I have to do. Because the counseling must have started 5 years ago. And that's good news. I was saying that this is
irreversible. She didn't hear that.
Not you. So I let them sign a consent form for the operation.
Okay.
I write there that 1% of this procedure in women will fail. Okay. I let them know that.
Okay.
Then
so
I will, yes, 1% will fail, and then the possibility that you can reverse is not that high. It's extremely poor. So don't even think of it.
Of coming back.
Once you have tied, you have tied. But I still know that I can still do something, because if you take them to theater to undo it, the chances that we will succeed is about 60%.
Oh, it's still high.
Yes,
wow.
But then we don't tell them, okay? So we just say
but is that not unethical or unprofessional?
No,
if you don't,
it is.
It's just lower your expectation.
Yeah, lower your expectation. Calm down. You know that song.
Calm
down.
Yeah.
Because if you don't do that, you can be sued.
Your clinic will be full of that one, and then you'll be taken to court.
Yes.
That's what the one who told me that this thing can be a reverse. So I tell them that it cannot be a reverse, but if the cross comes across, we are going to do a reversal, and the success rate is only 60%. I won't say it is as high as that. It's only Okay, I'll put the word only.
Only.
Yeah, and that's it. So it's a counseling thing. So when they come back 5 years down the line, I will say, okay, you are
Not changed.
I would
Like
say,
why you want
yeah, there's
change.
nothing we can do. But if you still insist, okay, let's try. Even if we try, you're going to have a risk of ectopic pregnancy.
Yeah,
a risk
because
of failure, because of those
additions.
Yeah, and so on. So you're going to have a risk of ectopic. So you when I risk, you know, and then your age has increased, and if your age has increased more than 35 years old, you will have a risk of or a higher risk of having Down syndrome baby. So you should be scared.
Yes.
Downs. So you will be looking after Down's baby for the rest of your life. And if you agree, I have no choice. I have to do it.
Okay. So Prof, that said, we talk about the different barrier methods, different options, and of course, there's nothing without even the natural ones. What are the consequences of long term? Because you're talking about hormonals.
Exactly.
Hormonals. I will know the effects. So let them know the consequences. And
the consequences of being on hormonal contraceptive or
some
barrier
progesterone
hormones.
alone, some estrogen, progesterone.
Yeah, you see those estrogens and progesterone in the pills, they can cause acne. Okay, if you are on those pills for quite a long time, you can have acne. That's one. Then the chances that
A long time is subjective.
yes.
Like
Long time. Okay, we
6
cannot
months,
put
1 year, 2 years.
we cannot put a specific time period.
Okay.
Everybody, some people will not have any issue at all, whereas some people will have issues after 3 months.
okay.
So I will even say three months. So some will say 3 months. I've started getting big, obese.
Exactly.
After that, having acne.
Weight gain.
After that, but if you use your contraception for a longer time, those problems might disappear. That's one thing. So you just don't run away from it because you are obese, because of this and that, and you can feel bloated. You feel bloated because of the progesterone content, whereby you are accumulating fluid. Okay, those things are temporary, but then if you continue to use for a long time, there are other issues that may occur. Don't give contraceptive to people who are hypertensive.
Why, sir?
So because the estrogen content, the progesterone, can make your blood pressure to be high, So you run away from that. Or otherwise, you need to manage the high blood pressure first before you give your pills.
Okay.
Okay, that's one thing. Then cholesterol is also an issue. People who have got high cholesterol level in their blood, they run a risk of heart problems and this and that and this and that. So you are not going to give them estrogen progesterone pills because of the risk of having higher cholesterol level in their blood. Okay, and you also going to the long-term benefits are also there. It's not only problems. If you have a woman who is kind of
irregular periods,
who has painful period.
Yeah.
Exactly. Dysmenorrhea.
Dysmenorrhea, give pills, it can help. If you have a woman who has got endometriosis, which is finding of the inside of the womb, outside of the womb, that is called endometriosis. It comes with pain. Those dysmenorrhea from endometriosis will be alleviated. If you have a woman with shutdown thing, can
polycystic,
if a woman with PCO, it can also help. Sometimes they say, don't quote me, people at home, please, but they say that if they use COC, the pill, the fibroid can even get shrinking.
Prof, that's in fact, we are just kind of, we are just like about to scratch into another topic, which I'm sure our viewers are very much interested about, and that means we are going to have you back here to elaborate more on that, because fibroid is a very common occurrence also in our community. But thank you very much, sir, for the schooling us on this benefit of female contraceptives, and of course the various options and long-term use that, of course, with side effects and the benefits that comes with it. So viewers out there, you've heard it from our renowned professor, who is a guru when it comes to women's health. And we have been talking about female contraceptives today. So if you're a female out there, what are the options that are available to you? And contraception is all about you having the number of children you want to have. So it's important that you know which one is right for you. It's not a one size fits all, right? And it's also not a walk in the park. There are advantages and disadvantages to that. I remain Dr. Memuna Yusuf Kadri. Until next time, remain blessed.
I want to join my voice to that to Dr. Memuna to just say thank you again for honoring our invitation and schooling us on the use of contraceptives and, of course, the consequences and benefits of long-term use. And one thing I want to just tell our viewers out there is from what you have said, it just means that no one should just walk into the pharmacy and procure a contraceptive. You must see a doctor or a family health practitioner so that they can actually examine you, do some investigation, and tell you the particular one that will be okay for you. Because it's not one size fits all. The one that is probably used for A will not be as suitable for your own use. So ensure you see a medical practitioner before you start using any of those contraceptives to avoid stories. We always say that touch. My name is Dr. Martina Agberie. Remember to follow us on our social media platforms, on Instagram, on Facebook, and on YouTube. So if you want to be part of this program, just ensure you go to our website, which is up and running, like PROF, and just send us an email, and you'll be here to come and enlighten people. Don't forget to always binge on our YouTube channel. We have over 120 episodes up and running on that channel. Till next time, stay blessed.